Title: Chill pills not enough. TM surgeon gone after a patient's waiting game turns deadly. TLDR. In a horrifying twist of events, a popular Tennessee surgeon, Dr. Benjamin Mork, was targeted and shot dead by a patient who spent several hours at the clinic waiting for the opportunity to strike. The shooter managed to escape the scene, only to be caught by the police minutes later. Now, as the town grapples with another violent act, questions are raised about patient-doctor safety, gun laws, and the underlying causes of such a tragedy. In a bizarre manifestation of the phrase "patience is a virtue," a patient lay in wait for several hours before unleashing fatal gunfire on a well-respected surgeon, Dr. Benjamin Mork, at the crowded Campbell Clinic Orthopedics in Tennessee. Dr. Mork, known for his specialization in elbow, hand, and wrist surgery, was highly respected amongst his patients, as evident by his impressive 4.9-star rating. He was even listed in the 2023 Top Doctors list by Memphis Magazine. Now, the question that lingers is, what led a patient, whose identity is yet to be released, to target this admired figure? Witnesses report that the shooter spared the numerous patients and employees present in the clinic at the time of the incident, focusing his rage solely on Dr. Mork. The shooter then attempted to flee the scene but was apprehended by police just 5 minutes later. A tragic end to what seemed like an otherwise ordinary day at the clinic, leaving us wondering, are healthcare workers really safe? Shockwaves continue to ripple through the community as they grapple with the loss. But perhaps the most jarring part of this narrative is a claim made by Tennessee Senate Minority Leader Ramesh Akbari, D. Memphis, that the shooter had been allegedly threatening a staff member at the clinic for a week. Akbari took the opportunity to call for stricter gun regulations, suggesting that if such measures were in place, the shooter might not have had access to the firearm used in the attack. The incident now raises questions about the effectiveness of existing gun laws and the urgency for reform. The saddest aspect of this tragic incident is that Dr. Mork leaves behind his wife, Rhiannon Mork, and their 2 young children. And while police are still working to uncover the gunman's motive, the rest of us are left to ponder over the very fabric of our society that leads to such a devastating occurrence. Is it time to rethink our approach to mental health, personal safety, and gun control laws? This tragedy comes nearly 2 years after a mass shooting at a local supermarket, reopening fresh wounds in a community still recovering from past incidents. Now more than ever, the question remains, is any place truly safe anymore? And as we stand here at the intersection of grief and rage, we are left with one haunting question: when will enough be enough?